Seeing quorum in the room, I'm going to call this meeting to order. I'd like to acknowledge that this meeting is taking place on the unceded, unsurrendered territory of the Algonquin Anishinaabe peoples, and we'd like to thank them for hosting this meeting on their land. I'm looking for a mover to approve the agenda. I see Trustee Aziz looking for a seconder. I see Trustee Presley. All right. If there are any declarations of interest that trustees feel they need to make, now is the time. Seeing none. I wish this didn't need to be said, but there is to be no name calling, no degradation of the character of trustees, and no yelling. This issue contains a lot of emotion. Tempers can get heated in these kinds of debates, but as the chair, I cannot abide snide or derogatory remarks. Insinuating that anyone around the table has ulterior motives, personal accusations of upholding or supporting oppression, or yelling. Prefacing these characterizations with a statement about how something is just your opinion, or I am just saying, will not circumvent the requirement for decorum and will be dealt with appropriately. We are all here in the best interests of children and discussing how to best serve the district and our students. If an individual fails to maintain decorum, the chair has the responsibility to remove an individual from the meeting. These rules apply equally to delegations, the staff, the audience, and the trustees. I'd like to call on the delegations to make their presentation. After their presentation, there may be up to 3 questions of clarification by trustees. I'm looking for Sephora Tanyan. Is Sephora Tanyan present? Not seeing Sephora. I'm going to look for Wade Shanley. Thank you, Wade. You have 2 minutes, which may be followed by up to 3 questions of clarification by trustees. Whenever you're ready.
Just before the timer starts. 2 minutes is short, so I will be reading really quickly, and apologies if I'm not giving you eye contact or anything. So my name's Wade Shanley. I'm the father of 3 children at OCDSB board, and I'm here to speak out against the motion. On November 15th on the Rob Snow Show, a trustee stated, "Just to be clear, it's not a debate. We're putting forward a motion and we have enough trustees that the motion will pass." I hope this isn't true, and I hope that all trustees remain open-minded and willing to consider the voices of their constituents. It's quite clear that your constituents in the polling have shown that they do not support this. Less than 10% of students are wearing masks. That is parents and students telling you they do not support mandatory masking. Point final. It's not the board's role or jurisdiction to make health policy in place of Dr. Moore or Dr. Etches. And in fact, they haven't mandated masking. And even in Dr. Etches' submission, she's not mandating masking. If the trustees wish to be involved in making health policy at the city or provincial level, they should have pursued that instead of seeking election as a trustee. Duration of the mandate has 3 criteria, and the first is that mask requirement will remain in place until such time as OPH declares the influenza season has ended. Directly from the Ontario Public Health website, flu season typically runs from late fall to early spring. So you're trying to mask kids until early spring. That is not just a short-term solution. As far as enforcement of the mandate, it's misleading to imply that 265(1)M duties access to school or class of the Act could be used to prevent students from attending school, as a healthy child with no mask today is not a detriment to student well-being, and the same would be true during any mandate. Furthermore, the board has specifically omitted 26(1)L, which is persons with communicable diseases, which is the appropriate article to be citing. They've done that deliberately because they're right beside each other and they didn't quote it. They know that they're not quoting that because they don't have the requisite authority under the Health Protection and Promotion Act. Boards also talked about suspensions under 306(1)(7) of the Education Act, but 306(6) sets out that the minister may issue policies and guidelines to the board to assist principals in interpreting and administering this section. And Minister Lecce has already said no students will be suspended or removed from class.
Thank you, Mr. Stanley. You are out of time. All right. If we could keep applause to a minimum. Thank you. I see a question from Trustee Blackburn.
Thank you, Madam Chair. Through you, Thank you for coming this evening, sir, and it was an honor to serve as your trustee for 12 years. Just a question of clarification. In the event that the board passes this mask mandate, will you require your children to wear a mask to attend school?
That there's no requirement for an exemption to a mandate that has no authority. So no, we won't comply, and the principals will do nothing because they can do nothing.
Trustee Presley?
Thank you again for coming in. We really do appreciate it. And it is our job as trustees to ensure that we are hearing the voices of all our constituents. So again, I'd like to thank you for your time. Just for a point of clarification for myself, would you be able to cite the resources where you're stating that 90% of parents don't want their children masked, just so I understand the clarification?
Yes, absolutely. So the board did a survey on the number of students that were masking. That is an implicit description that parents do not want their kids masking. Even if you want to be generous and say it's 80%, fine. 80% of your constituents absolutely do not support this policy. And if you are here to support your constituents and vote with what they want, it's not mandatory masking. People are still going to be free to mask if they want. Nobody wants to take that away. I don't want to take it away. There's plenty of people here masked, good for them. But it's the imposition of a mandate, forcing people who don't want to do it. And 95% of students are not masking right now, or whatever it was. It was less than 10%. So let's call it 90% of students are not masking. They do not want to do it. And if you're, I heard the argument that, well, you know, some of them are being bullied and that's why they don't feel comfortable. Well, guess what? When my children defied the mask mandate, they were bullied for not wearing a mask.
Thank you.
And they stood up for themselves. So it's possible. If you want it, you can do it.
Seeing no further questions, thank you, Mr. Stanley, for delegating. We're looking for Leah Transgard. Leah Transgard. Is it Lee? My apologies, Lee Transgard. Okay. I'm looking for Adam Saunders.
Good evening, everyone. Thank you for the invitation to speak. I am a lawyer and a parent of 2 children who attend OCDSB schools. Last year, I persuaded a school in Gatineau that my children used to go to build air purifiers to engineer cleaner indoor air, a school for over 600 children. And that's why I'm going to talk about masks and engineering. There is an urgent need to reinstate a mask requirement for the remainder of the academic year because OCDSB classrooms have not been made safe to be inside unmasked. They can be made safe through engineered solutions, but that will not happen overnight. Our community is suffering from multiple epidemics of acute illness, which have collapsed our healthcare system. The recent collapse of acute pediatric healthcare is what's brought us here tonight. There is also an epidemic of chronic illness and disability that is not being talked about nearly enough through the long-term consequences of COVID-19 infection, even in mild cases, with between a 5 to 20% chance of long COVID per infection. As it is easy to be reinfected, all residents of Ottawa will continue to be at high risk of long-term disability from COVID, including our children. The only way out of a future with widespread long-term disability, with children robbed of their childhood because they're too fatigued to get out of bed, is to engineer clean indoor air. And humanity has engineered itself out of public health crises before. For example, in the middle of the 19th century, engineers raised the entire ground level of all buildings across downtown Chicago. They did this to eliminate the spread of waterborne viruses such as cholera because they were drinking water where their sewage, where their human waste was going. They decided they didn't want to drink that anymore. It worked. The water became safe to drink. Engineers have also developed technologies that rapidly destroy airborne viruses to make indoor air safe to breathe. One is upper room ultraviolet germicidal irradiation used safely for decades. Another is far UVC irradiation. For schools to be safe to be unmasked, and those solutions need to be installed following consultations with engineers to ensure it is done safely and appropriately. In the meantime, a mask requirement is urgently needed as a stopgap for everyone's safety, especially our children. Only once those solutions are installed will it be safe to be unmasked inside schools. Thank you.
Thank you.
I see a question from Trustee Scott.
Thank you, Mr. Chair, and thank you for your delegation. I wondered whether you were aware of any other school districts or large institutions such as healthcare institutions or colleges, universities that are actually using either irradiation or high or far ultraviolet irradiation.
That's an excellent question. Actually, I think one of the best examples of that is Ashish Jha, who is the United States White House commissioner essentially for COVID-19. He's spoken at a number of conferences unmasked, and you can notice in the background that these bright kind of purple lights that are hung up near the height of the room that's zapping the air, destroying viruses. And his children actually go to schools that have had millions of dollars in investments into indoor air quality, ventilation, smart CO2 monitors that he can access at home safely at any time he wants during the day to make sure that his kids are breathing safe, clean indoor air.
Thank you.
Can we keep side conversations to a whisper, please? I see a question from Trustee Aziz.
I thank you again for taking the time to speak with us about your concerns on a Tuesday evening. My question is to clarify and condense your position is, and correct me if I'm wrong, that you would like to see a short-term solution to the current crisis being a mask recommendation or mandate, and a long-term solution be investments in technology like quality air filtration. Is that correct?
That's right, because I hate wearing masks. I actually don't enjoy this. I used to throw some of the best parties at the end of every year. I'd have like 80 of my best friends, family all together. But it's just not safe. And so we just like Chicago didn't want to drink dirty water anymore. I don't want to force my family to breathe clean air. Once we engineer that change, then it's safe again.
Thank you.
Please remember that everyone was quiet while all the other speakers spoke. That's still all of them. So thank you. I do not see any other trustee questions, so thank you for your delegation. We are now looking for Roosbay Martin. Mate. Okay. We are looking for Ray Watt, Deedandan. Oh, I see you have come up on our screen, but you are muted. Ray Watt, thank you for delegating. You have 2 minutes when you're ready.
I'm sorry, did you say Roosbay or Ray Watt?
Ray Watt.
Okay, that's me. That is me. Yes, that is me.
Yes, it is.
Okay. Okay. Sorry, can you hear me? Can I start? Can you hear me?
Yes, you may, when you're ready.
Okay. My name is Ray Deonandan. I'm an epidemiologist and professor at the University of Ottawa, and I'd like to make 3 points this evening. First is that there is zero evidence that mask wearing is harmful, long-term or short-term. Sorry, I got cut off there for a second. Can you still hear me?
We can hear you.
Okay, I'm sorry. There is zero evidence that mask wearing is harmful, long-term or short-term to either the physical or mental health of children or adults. Any claim to the contrary is opinion, not fact. The exception is occasionally headaches and acne for those who are prone to such things, as well as those who need to read lips, they need special accommodation. My second point is that there's a mountain of evidence that shows that masks work to slow transmission of respiratory diseases. This includes a large California study that shows if you wear a mask, you have an 83% lower chance of getting COVID, and a randomized trial in Bangladesh, this is important, that showed that increasing mask wearing by 29% in the community, just 29%, resulted in a reduction of 11.6% of COVID symptoms in the community. That doesn't sound like a large number. That's huge when it comes to slowing transmission. And my third and last point is that the crisis in CHIO's ER is real and scary and driven by diseases that mask wearing prevents. There are no solutions on the table, none, to slow the demand for care. The only possible solution is widespread masking, which is why CHIO leaders are asking for this. It doesn't have to be perfect. It doesn't have to be all the time. It doesn't have to be forever. We just need enough people to wear masks most of the time, whenever they can, however imperfectly, and not just those at risk, like small children, but everyone who could come into contact with those at risk, like older kids and educational workers. That's how population health works. So that should be enough to slow the hospital traffic and save
Thank
some
you.
kids' lives. Thank you.
I see one question of clarification from Trustee Aziz.
Thank you again for taking the time to speak with us and for joining us virtually. My question is about, why now why do you think, in your opinion, if I'm allowed to ask of the delegate, why do you think this is such an important issue? Why has this become an extremely concerning point of contention and emotion for many folks, where we see this discussion of masks become incredibly emotional?
I think mask wearing has become politicized for reasons having nothing to do with the science. I think it's become a symbol of people who want normal back at all costs, with the sense that the crisis is over. The crisis is not over. Mask wearing is a low-cost, cheap, high-impact intervention that keeps the economy and schools open. And it doesn't have to be forever, like I said. It's something that we can all control individually. So my understanding is that any opposition to it is ideological, which is fine. It's emotional, which is fine. It's just not based on scientific evidence.
Thank you for your time and thank you for your response.
Thank you.
I see a question from Trustee Kaplan-Murphy.
Good evening, and thank you for addressing us this evening. I would just like to know if you could address quickly the issue of equity and why mask wearing is also an issue of equity. Thank you.
Right. So not everyone can afford to keep their kids home. It's those of us who are wealthy and work from home and have paid sick days and so forth. The rest of the people have to send their kids to school. And if they're sick, they're still going to school. Sick kids are going to school and infecting other kids for reasons that we cannot control. This is disproportionately affecting the lower income, those at the bottom of the socioeconomic ladder, and kids who are immunocompromised, who cannot protect themselves, need protection from the rest of society. This is how population health works. We have to protect each other, especially now that there's a crisis in the ERs. Kids are going to die unless we slow this traffic in the hospital system very soon. There's no other solution on hand. If there is a solution, great, let's hear it. But I haven't heard one yet.
I was not able to hear the end of his answer. Could he please repeat it again and have the room silent?
I was saying that there is no other solution on the table to slow the hospital traffic right now. Mask wearing isn't going to solve it in and of itself, but it's going to slow traffic in the hospital system. And unless we do that, I think some kids are going to die unnecessarily. I think Dr. Sampson is going to give a presentation on the tragedy in the ERs at the moment. I hope she does, because I don't think people understand just how bad it is. We need to protect children. And the best way of doing so right now, absent the engineering interventions that were mentioned by an earlier speaker, is to institute widespread mask wearing. And if people aren't going to do it voluntarily, unfortunately, it may come down to a mandate.
Thank you very much.
Thank you.
I understand that the audience has strong feelings about what is being said by the delegations. I understand that members of the audience will have strong feelings about what is said by delegations, regardless of which side of this issue you land on. Please refrain from yelling out. It's going to make this meeting take longer if we have to have all of our delegations repeat what they have said. I see a question from Trustee Jenikins.
Thank you, Chair, and thank you to the delegation. My question is in regards to your point on lack of evidence on harm to our children. When you, as a health professional, when you're evaluating a child's progress, do you take into consideration a parent or a caregiver or a teacher's evaluation of their own child's progress? Are you mindful when a parent says to you that my child is delayed, is not progressing? Do you trust a parent's opinion on their child's progress?
First, I'm not a healthcare professional. I'm a PhD professor. I'm an epidemiologist, a population scientist. So I look at the published data and what is a consensus opinion among scientists. Individual healthcare providers and clinicians, I hope, are taking into consideration the opinions of parents and folding that into that child's appropriate therapy and medical response. But that is not the role of a population health scientist like myself.
All right, thank you. That is the 3 questions we're allowed. So I'm going to be looking for Jesse Vermeire, Vermaire. Not seeing Jesse. I'm going to be looking for Carolyn Moffett. Carolyn Moffett.
She's also virtual.
She's virtual, okay. There you are. Oh, you're gone. There you are. Okay. Ms. Moffett, you have 2 minutes and then up to 3 questions of clarification from trustees. Whenever you're ready, you may begin.
Thank you. Are you able to hear me?
Yes, we are.
Okay, great. Thanks. It's hard waiting in the waiting room and then setting it up so quickly. Sorry, I'm dragging like Rowett. I'm just dragging my documents around so I can see them. Thank you for your time. My name is Carolyn Moffett, and I'm a parent of 4 OCDSB kids. I'm a policy advisor who previously worked with influenza and pertussis guidelines. I'm also a retired midwife with experience in NICUs and with vaccinations. My comments tonight apply to the triple threat that we currently have, which is COVID-19, influenza, and RSV. Masks are an important equity tool to make schools accessible. They prevent illness and thereby stop absences and the serious consequences of illness. The lack of hospital access for kids is a serious consequence. There's no sense of community solidarity since leadership is not modeling mask use in our schools. The weak suggestion from the board have not resulted in staff or students choosing masks. Only 10% of people in our school are wearing masks this week, despite CHIO's pleas. I'm asking for OCDSB to make an internally consistent decision and mandate masks in the schools now, just like you did in the past when the situation in the community was dangerous. Hospitals are in more of a crisis now. COVID isn't over. Kids are sicker than in past years. We cannot assume that all kids get sick outside of school. What happens in school matters. Many families are like mine and don't participate in unmasked events and are still cautious about catching COVID or other germs. The board has a duty to have consistent protective policies so that families can trust that their kids and family members will remain safe while attending school. Your decisions should be predictable and make sense. Do now what you did then. Help our community now and make masks mandatory inside school buildings. I also want to share a little bit about my own experience as a high school student who got repeatedly sick. Like many, I caught mono in high school.
Thank you, Ms. Moffett. I'm afraid you are out of time.
Thank you.
Are there questions? I see Trustee Aziz.
Thank you again, Carolyn, for taking the time to speak with us virtually. Hopefully you can see me and I'm not just an ominous voice on your screen.
You're just a voice, but that's okay.
Okay. My question is a clarifying question. You mentioned masks being considered because of the concern in regard to hospitals and CHIO. May I ask to clarify why that's important in considering masks, why we're thinking about hospitals and CHIO in this particular instance? Why is it important for us to consider masks or no masks in the context of your point on hospitalization and CHIO?
Well, I get, so it has been in the news and broadly shared by CHIO itself and by other news sources that there's a pediatric hospital crisis at CHIO in Ottawa, but also in other hospitals in Ontario and across North America right now, which means that there's an increased chance that if your child gets sick, they won't get timely care and that could have serious consequences. So with hospital worker burnout and more severity of kids getting sick this year, the statistics show that when we look at like wastewater testing and ratios of test results in the community, we're seeing that a similar amount of children are getting sick with RSV this year, but the consequences of those sicknesses are more serious, so more kids are getting hospitalized with it. So despite it not being statistically more gigantic number of kids that are sick with RSV, which sometimes is like a cold, but sometimes is a terrible mucousy, overwhelming cold for kids, and especially for little ones. The kids are ending up in hospital. And so we don't know if it's because they've previously had COVID or if it's because their immune systems are weak for some other reason, or if the RSV bug is really bad this year. We can't solve those scientific problems right now, but what we can do is we can stop more kids from getting sick with the major respiratory germs this season. So we've got like influenza, RSV, and COVID that are circulating right now today. And if we can stop those germs from getting into your lungs by using a mask, then fewer kids will be ending up in hospitals. And when fewer kids are going there, kids can get care in a timely way.
Okay, perfect. No, that does answer my question. Thank you again.
Trustee Presley.
Through you, Chair, if I may address everyone in the room for just a moment. We are all here for the best interest of our children, and it makes it extremely difficult to hear the responses of all delegates.
Trustee Presley. I'm sorry, that's not a question to the delegation.
My apologies.
Do you have a question for the delegation?
I do, actually. Thank you. Before your time was off, you were starting to speak on your experiences of you being a high school student. My question is, would you be able to elaborate on that for us?
I'd be happy to. So in
clarification, I'm sorry.
Okay, retracted. Thank you.
Should I answer or not?
No, I'm afraid no.
Okay.
Questions have to be questions of clarification, not just continue telling your story. I see no further questions. Thank you, Ms. Moffat.
Thank you for your time.
I'm now looking for Salma El-Shahabi. I heard somebody say she's on Zoom. I am looking for Salma El-Shahabi, and I was told that she is on, oh, there she is. She's on Zoom. Hello, Miss. You have 2 minutes. Thank you for delegating. You may begin when you are ready.
Hi.
We
Do I
can.
have? Okay. My name is Salma Shahabi. I'm a mother of one son who's in the school now. I want to talk about not requesting or mandating masks on the students. It's important for the development, for their ability to communicate. That's one, I know you've heard it enough times. We've had enough discussions about these, but I would like to reiterate it. And I also would like to say there has been the online learning over the duration of COVID when people were staying at home. I think that would be a solution to suggest for you, for those who are more concerned about their child contracting any of the sicknesses going around right now. My son was sick just last week and I kept him at home for the whole week. For those who were talking about equity, I am not a rich person. I am staying at home mom, and I kept him with me because I didn't want any of the kids to get sick. So until I felt he was safe enough to go to school, that's when I sent him. And I think if we do the personal hygiene, you know, making sure the kids wash their hands, because I know a lot of the kids may not be doing that in schools before COVID. I'm not even talking now. If we just stress out these, it would, I hope, help with the elimination or containing these. And if we're going to talk about Dr. Moore, who did strongly recommend this, he was seen without a mask just this week after strongly recommending have that. And when the ministry was contacted, it was a personal choice. People were given the choice to make it. I think it's good for the children to have that personal development where they make that choice if they're old enough to do that. And for the younger ones, I think the adults are the one who are gonna, make sure there's, if a child is sick, send them home. I know some people say not every parent is going to be able to do it, but it's something that will protect the community.
Thank you, Ms. El Shahabi. I see a question from Trustee Kaplan-Murphy.
Thank you for your delegation. I have a quick question for you because I know that there are lots of parents who can't afford to stay home with their children when they're sick. And I'm wondering how many days roughly have your kids had to miss because they're sick in the last year? And what should parents do who can't afford to do that? I would say that as an equity issue, we should make schools safe for everybody.
You can only ask a question.
Sure. Okay, so the question is, how many days have your kids missed because they're sick since September?
Since September, it's been 5 days because he was sick for 2 days, but I wanted to make sure he's not going with anything left over. So I kept him for another 2-3 days until I made sure he's, it's not just that he's recovered from a fever, he actually doesn't have a cough. So that's what I did. Yeah. But it will differ from one kid to another. I'm sure it will depend on, how sick they are, what they have. I don't even know what my son had. So, but that's going to be something relevant from one person to another. It's not going to be.
Of course. And do you have friends who also have sick children?
If you have a second question, put your hand up.
Oh, sorry. I was sort of a follow-up.
You have a second question? Okay. Go ahead.
No, well, it doesn't have to be if somebody else has a question.
I see no other questions. So.
Okay. I just, as a follow-up, do you have other friends maybe who've had kids who've been homesick who don't have sick benefits and it's hard for them to stay home with their kids when they're sick?
To be honest, I don't have many of them. Who actually I do. I just remember one. But yeah, the mother stays home and she keeps the kids when they're sick at home. She has 2 kids, not one. So when one gets sick, the other one gets sick, and both of them get to stay at home because of that. But I also know a lot of families within my neighborhood who actually chose to move from OCDSB altogether and go to the Catholic board because of the mandates they had last year. So this year they just didn't want to deal with it and they moved on to the Catholic board completely.
I'm sorry, I can't hear her answer. Can you please be quiet so she can repeat it? Thank you.
Trustee Kaplan-Murphy, I have to ask you not to chastise the audience. However.
So I was saying is there are a lot of the kids in my community who were in the OCDSB and they moved on to the Catholic board because of the mandates that were dictated last year and how it impacted their children's development and learning over the span of the end of last year when you guys where you were the only board who had that mandate and the rest of the city didn't really have the mandates at the time. So I know their decision wasn't done then because it was almost the end of the year. They moved their children this year to the Catholic board and half of my neighborhood kids are in the Catholic board now.
Okay, thank you very much.
Their children's learning is, it's much important for the children to learn, but it also builds the immunity when they get sick. I'm not saying we have to get them all sick, but
Thank you, Ms. Al-Shahibi.
Thank you.
All right, so I'm going to ask the audience not to clap or cheer until the end of whoever is speaking's time. Okay? And I'm going to ask you to police each other a little bit, okay? Okay. I'm now looking for Stephanie Phillips.
Thank you, guys.
Stephanie Phillips. Okay. I'm now looking for Blake McGuire.
Thank you for having me come out speak tonight. I didn't realize how formal this was going to be.
So I've made some notes here. The first thing I'd like to say is, I'd like to remind you all that you're elected officials by the people right here. And their voice is being heard right now. They're saying no to masks. And I mean, that's the strongest message you can hear right now. It's a democracy. You don't make the decisions for us. They were elected. You were elected to hear the people who are talking to you. So on that, I'd like to share how masking affected my kids, because I'm a father of 4. And immediately I noticed a difference in all my kids when the masks came on. I noticed anxiety. I noticed depression. My A student became a C student. Sorry. They're not good for kids right now. They're going to harm kids. Don't do this. I'm literally begging you not to do this to the kids in our educational system. You think you're doing the right thing, but you're not. They make kids afraid of each other. My youngest has a friend next door who he's known since he was a month old. And she ran over to him and he was scared of her because he thought she was going to get him sick. This is what masks are creating. This is what we're trying to not let happen tonight. This is a freedom of choice. When only 10% of the kids in school right now wearing a mask, a study done by the board, it's rather obvious. Parents are speaking. They're saying, we don't want to mask our children. So I don't think you should override that and decide for them. You were elected to listen to them. So please do.
Thank you, Mr. McGuire. I see a question from Trustee Blackburn.
Sorry,
Okay.
I forgot about the questions. That's why I came back.
Trustee Blackburn, question of clarification.
Thank you, Madam Chair, through you. Thank you, sir, for joining us this evening. So just to clarify, would you be comfortable with the board strongly recommending that students wear masks and leave it up to choice?
I would welcome anybody who wants to wear a mask and that recommendation from the board. If you want to wear a mask, wear a mask. That's your choice. If you don't want to wear a mask, I think that should be respected as your choice, your freedom.
Seeing no further questions, thank you, Mr. McGuire.
Thank you.
I would also like to thank the community providing us with their written delegations. These delegations have been included in the agenda package and will be and has been published on the district website. Moving on to item 6, I'm now looking to the vice chair to report to present the in-camera report.
Chair, if I may. Vice Chair Bell had to step out for a family reason,
Okay.
so I will be making that report on her behalf.
Okay.
So this evening, the board met in camera and reports and recommendations were as follows. There was a human resources matter, and so I move that staff be authorized to proceed as directed in board, in camera with respect to a human resources matter.
Okay, so the board met in camera this evening and had our discussion. We are going to be voting on this in camera human resources matter. Yes, Trustee Scott.
Thank you, Madam Chair. I didn't hear that there was a mover and a seconder, so that is an essential part of this.
Yes, it is, to my recollection, moved by Trustee Scott and seconded by Trustee Lee. As the person who brought it in from in camera, you second it.
Correct.
Okay. So we now need a recorded vote on this item. And I'm going to ask Manager Guthrie to call the roll.
Trustee Aziz,
In favor.
Trustee Blackburn,
In favor?
Trustee Dixon,
In favor.
Trustee Jennekins,
In favor?
Trustee Kaplan-Mirth,
In favor.
Trustee Lee,
In favor?
Trustee Milburn,
In favor?
Trustee Nash,
In favor?
Trustee Presley,
In favor?
Trustee Scott,
In favor.
Trustee Lyra.
In favor. That is 11 in favor, 1 absent. And to assure the people in the audience, that was not about masks.
And Madam Chair, if I could finish the rest of the report.
You may.
Then the board also met on a second item in camera where we had the opportunity to review a legal opinion and obtain legal advice about the issue of the board's legal authority to impose a mask mandate. And in the debate tonight, we will be guided by that discussion.
All right, thank you. That brings us to item 7. I would like to introduce Dr. Lindy Sampson, Chief of Staff and Chief Medical Officer of CHEO, and ask her to make her presentation.
Good evening, everyone. Can you hear me okay?
We can.
Great, thank you. I'm here on behalf of CHEO, where I have been working since the 1990s. I'm a pediatrician and an infectious disease specialist, and I'm now also CHEO's Chief of Staff and Chief Medical Officer. First, I do want to start by congratulating all of you on your recent election to the board, and thank you for your commitment to the kids in our community. I also want to thank you for inviting CHEO to join this important meeting this evening to provide an overview of what we have been seeing over the past month or so and what we know to date about viral transmission and how to prevent it in children. I also do want to thank all of the delegates who came to present this evening. It's important to state up front that there is compelling evidence demonstrating the importance of children being able to consistently go to school and the positive influence that that has on their physical, developmental, and mental health. The impact of the last 2.5 years and the disruptions to in-person schooling on our kids can't be overlooked. As a child and youth health organization, we believe that keeping kids in school is imperative to their health and well-being this year. There's been much commentary of late about what's been happening at CHEO right now, so I thought I would start by painting a bit of a picture. Last night, if you had to bring your child to the emergency department for non-emergency care, you would have waited as long as 13 hours to be seen by a physician. This is even with the addition of a new clinic, which is running 12 hours a day with up to 3 physicians there at a time to see as many of those children as possible from the emergency department. Yesterday, our intensive care unit, which is where the sickest children need to be to get their care, such as those who need help and support with their breathing, was at 200% occupancy, with half of those children having to stay in non-traditional intensive care unit places in the hospital, as we didn't have enough room in our pediatric intensive care unit. We were at 185% capacity of those who don't need critical care, but still require admission to hospital for a significant illness. The overwhelming majority of these children had a viral infection and needed extra oxygen, help managing their secretions, or had developed a secondary issue such as a severe pneumonia as a result. What's most challenging is that many of those kids had to wait in our emergency department for a few days, receiving the care they needed, but in less than ideal circumstances, as we simply were too full and didn't have an available bed on our wards. Finally, because of this surge, the need to redeploy extra nurses, therapists, physicians from their regular work to care for all these admitted patients, as well as the need to free up space to be used differently to house those kids in, we're having to delay needed clinical appointments, surgeries, including even heart and brain surgery, as well as other procedures, all of which are extremely important, but maybe not immediately life-saving to those kids. Many kids had already waited way too long for those appointments, and now the wait has been prolonged even even more. None of this is okay for our kids and their families. I'm hearing from families each and every day, whether they're those whose children are being admitted to hospital or those whose needed healthcare is being delayed, that this is not okay, and their kids and their families are suffering as a result. What we're seeing in the Ottawa region right now is a unique surge in kids with viral respiratory infections, and these at the moment are mainly RSV, influenza, and COVID, but also include others. And while we would usually see all of these, well, almost all of them, because not usually COVID in the pre-pandemic years, over the course of a year, right now, they are all here and spreading amongst our kids at the same time. You will have heard in prior pandemic years at CHEO that we were experiencing a surge in the number of emergency department visits for a very short period of time each winter. This in and of itself is not new to us, but three things are different right now. The first is that this has been going on for a month already, and while we're hoping we're at the peak and that the number of children requiring care will soon plateau, our best modeling predicts that we're going to continue at this level for at least another 4 to 6 weeks. The second is that there are more children coming in for care who are sicker and requiring admission to hospital than we've ever seen before. Never in the 25 years that I've been at CHEO has this many patients required intensive care for viral-related breathing difficulties or admission to hospital to manage their viral infections at a single given point in time. And the third difference is that every children's hospital in the province, well, actually in the country, is experiencing this same surge simultaneously. So we really can't count on them to help us out and vice versa. We are all hands on deck to manage this so that we can ensure every child who needs our care can get the care they require when they need it. We're opening up new spaces, bringing in more frontline clinicians where and whenever possible. However, we simply don't have the resources to surge any further. And therefore, we're looking to do whatever we know works to stop the spread of viral infections amongst kids as soon as possible. Evidence does support the effectiveness of masking in stopping viral transmission in the community at large, in healthcare
Dr. Sampson, one
environments.
moment. This is not a delegation. This is a presentation by a partner organization with the OCDSB. They don't have a timer in the same way that the delegations did because they're a partner organization. My apologies, Dr. Sampson. Please go ahead.
No worries. Evidence supports the effectiveness of masking in stopping viral transmission in the community at large, in healthcare environments, and in school settings. The most recent school-based studies show that even in the oldest of physical facilities and in the highest risk neighborhoods where many kids do live in crowded housing, that universal masking led to significantly fewer COVID infections in those children. And I want to remind you that masking is only one of the several layers of protection that we know work to stop the spread of viruses and to decrease the likelihood of severe infections. Masking in crowded and indoor spaces, staying home when sick, washing our hands diligently, and getting all vaccines, COVID and influenza that we're eligible for. In addition,
one moment, Dr. Sampson, my apologies. I really do not want to start evicting people from this meeting, but if you insist on causing a ruckus, I will have to. Please keep your voices down while people are speaking. My apologies, Dr. Sampson. Please continue.
No worries. In addition, it is important for school boards to do everything possible to ensure adequate and equitable indoor air quality, ventilation, and environmental cleaning. You know, CHEO and health experts making the strong recommendation to mask in indoor and crowded places, including schools at this time, is not intended to be political or polarizing. It's about what we can all do as a community to help each other and help our kids.
One moment, Dr. Sampson. My apologies. Security, the next time somebody makes a ruckus, can you identify them? Thank you. Please continue.
Yes. Our provincial scientific advisory guidance document for this school year
Dr.
did
Sampson,
not.
please pause for a moment. Change your mind through anything Yeah. Sir, please leave. You are now being told to leave. Ma'am, you're going to have to stop streaming. I cannot hear when everybody is speaking. You're supposed to leave. Ma'am? Ma'am, you have to leave. You are welcome to follow along on the live stream online. We're going to have to take a brief recess. No, the board's in recess.
Mike, please cut the mic.
Us? I don't think you can hear us. Okay.
Sorry, I'm not sure if you were speaking with me. I can hear you now. I couldn't hear you before.
Excellent. Our meeting is going to resume. Thank you so much for waiting. Would you please resume your presentation?
Great, thanks everyone. So, I think at this point, I just really like to close and then I'm happy to answer some questions. I do want to close by, sharing our recommendation that at this moment in time, given the current unprecedented surge in viral activity in our community and in the numbers of kids requiring admission to hospital and intensive care support as a result of these infections, that it's time for our community to do everything we can to stop the spread of viral infections, including temporarily wearing masks when indoors, staying home when sick, practicing good hand hygiene, getting all vaccines that you're eligible for influenza and COVID. And I just want to emphasize that our recommendation to return to masking is temporary and only for as long as there's this degree of viral activity in the community, this extremely high number of children requiring admission to hospital, and this degree of crisis within our child and youth health system capacity. Our kids really need our attention right now and deserve our support. So thank you for inviting me to present this evening, and I'm happy to answer any questions.
Thank you, Dr. Sampson, for your presentation. I see Trustee Aziz, you have 5. We're going to make it 3 minutes because we are short on time. You have 3 minutes.
Thank you, Madam Chair. I've got 3 questions for you, and if I may ask them all at once, just to preserve time, but I see you grabbing a pen and paper. So my first question is, at the beginning of your presentation, you mentioned the importance of keeping our kids in the classroom as a component of their health and well-being. My question is, based on that suggestion or point of discussion, how can the board support keeping our students learning in the classroom? My second question is, and I can't tell if you're still writing. Oh, we're good. Okay. Second question is, you mentioned the current 13-hour wait at CHIO. Is that correct? Would you be able to provide a comparison of other wait times either during the summer or earlier this year for sake of comparison to gauge that 13-hour wait time? And finally, my last question is, we've heard your recommendations and I appreciate you putting those together. If we do not implement any of those recommendations you're making, or if we do not pass a mask mandate, what would the outcome be? What would be the consequences of not abiding by or following those recommendations? Thank you.
Dr. Sampson?
So I just wanted to make sure I can remember all of them. So, your first question, thank you for them, was about how can the board support keeping kids in the classroom? And I can offer you my perspective from a health lens. I think what we need to do is make sure that that kids are well enough to come to school. And we know that kids really shouldn't be coming to school if they're sick and unwell. Likewise, it's very important to think about the wellness and well-being of all of our teaching staff and other staff that support our kids in the classroom. And so I think from my perspective, thinking about it as how do we diminish as much as possible, and there's no silver lining and there's no magic one thing, but how do we do that as much as possible to keep kids well enough to be at school? So really it's about putting masks on when indoors and in crowded spaces. It's about ensuring people do stay home when they're not well so that they're not spreading infection. It's about ensuring that we teach and support kids and our staff in using effective hand hygiene, and really encouraging and recommending that we do all the things that we know work, including getting vaccination. That's the first question. The second one is, the comparative wait time. So of course, waiting any length of time when you think your child is sick and needs care is really, really challenging for the kids and the families. We are seeing wait times that we have never seen before at CHEO. They have peaked even beyond that 13 hours. And the thing that's different now is that instead of having one small period when we reach our peak wait time for the day, that's staying at a prolonged wait time for many hours during the 24-hour period of time. So our goal is to not have children wait longer than, longer than 6 hours to see. Even that's too long. But when we're seeing 13, 14, 20 hours, that's too long. I just do want to emphasize that any child that comes into the emergency department that needs emergent care gets that care immediately. And so those children are not going to wait. And in fact, the fact that we're seeing more of those children lately is we're appropriately putting all of our effort and energy there. And that does then mean that other children are having to wait longer who can safely wait, but it's not okay to wait that long. And it's not easy for the children and for their families. Your third question is, if you don't pass the mandate, what can I predict the outcome to be? And I don't think that's an answerable question at this point in time. Every little bit that we can do to help stop this current viral surge will be helpful. And so passing a mandate where children at this point in time, if every child in a classroom and every teacher in a classroom who is able to do it comfortably to mask, puts a mask on, that will help keep more kids from getting sick. The decision about how best to do that, to encourage and have as many children and staff do that, is for the board to make.
May I ask one follow-up to that?
You have a minute 32.
Thank you again for answering those questions, and thank you for taking them kind of rapid fire and writing them down. I do appreciate that. To go back to the wait times, just because, the long CHEO wait times are a point of discussion and debate. I guess it's a two-parter. One, during previous peak points in the spread of COVID and other viruses, did we see a similar prolonged wait time of 13 hours? And the second question I have is, many of us have been to a hospital ER before and know that wait times can be long, generally speaking. Has CHEO ever, in recent memory, had that 6-hour wait time, or is that something that has never been achieved before, where there was a shorter amount of time for children to see a doctor or whoever, or a nurse?
Yeah, thanks. And I just want to reassure everyone here, we are doing everything possible, all hands on deck, working collaboratively with our community partners, our adult hospitals, our family physicians and pediatricians in the community to address all of these issues, to ensure children can get the care when they need it at the time that they need it. So during previous peak seasons, have we seen wait times this long for as prolonged times as we're seeing now? No, this is unprecedented for us. As our so that's answer to your first.
Dr. Sampson. Ma'am, you are being asked to leave. If you do not leave, we will be forced to trespass you. Ma'am. My apologies, Dr. Sampson. Please continue.
That's okay. I think the answer to the second one was, have we ever achieved lower wait times? And I just want to clarify that yes, we have. And sometimes somebody, a child comes in and there isn't an exceptionally long wait time. So yes, we have achieved that in the past. And I just also want to emphasize that any time that a child comes in that needs emergent care, they receive that right away, 24 hours a day, 7 days a week. And that's a real priority.
Ma'am, you were asked to leave. Ma'am, you were asked to leave.
No.
Ma'am, you were asked to leave. We will not be answering your question. Thank you, Dr. Sampson. Trustee Aziz, you have about 10 seconds left if you want a very quick question.
May I wait for the crowd to settle a little bit? Just so I
Yes.
can hear Dr. Sampson's response.
Sure.
Point of order, Chair.
Yes, who said point of order?
Point of order.
Trustee Bell.
I would appreciate that our staff not be put at the front lines of this. Can we call a recess, please?
All right. So I'm afraid we're going to have to call another recess. Hello, everyone. Seeing quorum in the room, I'm going to resume this meeting. Okay. So I believe we were partway through, we were in the last 10 seconds of Alicia's questions. Before we begin again, I'm going to encourage folks to remember that we only have 2 hours left at this meeting, and to keep your questions concise. And Dr. Sampson, if you could also keep your answers concise, I would appreciate it, given that I would like to finish by 11 o'clock. All right, Alicia or Trustee Aziz?
I think Dr. Sampson had answered my question before we were interrupted, but I would like to thank them for their time, for answering our questions in detail and bearing with us during those recesses.
Okay. Next on my list, I have Trustee Lee.
Thank you, Madam Chair. So, Dr. Sampson, thank you for taking the time to speak to us today. There's just 2 questions I had for you, and it relates to, as part of the motion, some aspects that pertain to your purview at CHEO, and that is the benchmark of 85% as a way of determining when we would lift a mandate if it was implemented. So my first question is this metric publicly reported? Because I haven't been able to find any such data other than what's reported in the news.
Yeah, I'm not quite sure how to answer the question. Yes, it is publicly reported, and it is not, that is not the metric or outcome that that's a decision for the board to make. At this point in time, I think we are recommending masks be in place until the end of the current situation, which doesn't involve looking at our PICU occupancy metric.
Okay, perfect, for sure. I understand that that was not the recommendation that came from you, but because we have it as part of the motion as one of the metrics, so that's just so we can stay informed of what we're voting on, essentially, just so we have some information. And so as a follow-on to that, from what I've seen for operational planning documents from other hospitals, it suggests to me that 80 to 85% ICU occupancy is an operational plan, so that there's surge capacity. So I guess the question is, from the data that we have at CHEO, is a 2-week period below 85% occupancy something that is, I guess, achievable for a long duration of time, or is that kind of the 85% line where the occupancy usually sits at around?
So the ability to so 85% occupancy in and of itself is not of our intensive care is not an indicator of our current capacity, given the situation, staffing pressures, the number of children requiring care is not an indicator of whether the child and youth health system is in stress or not. We are rapidly opening new intensive care unit beds, and so that's a moving target at this point in time.
Okay, thank you very much.
All right. Next on my list, I have Trustee Jennings. My apologies. Next on my list, I have Trustee Donna Dixon.
I guess my question is, the long wait of 13 hours, does that have anything to do with the shortage in nurses and doctors that's happening across Ontario right now?
You know, the current state of the system is very multifactorial. What got us here and what is keeping us here in this situation. There are long-standing gaps in the support of the child and youth health system that predate COVID. Currently, as everywhere in Ontario and right across the country, there are health human resource issues that are impacting our ability to provide the care that's needed given the current viral surge in pediatrics. So I would say those wait times are multifactorial, including the number of children that require admission to hospital that need to wait in the emergency department for a bed. So then that actually prevents us from being able to see more children in the emergency department that could just come in and be seen. It's a complex system, and there's no clear one answer to provide that information to you.
But it has a factor, right? It plays a factor. Or are you saying it does it?
Health Human Resources is definitely playing a factor, not only at CHEO, but right across the health system in Canada right now.
Is that all? All right. That brings me to Trustee Kaplan-Murphy.
Good evening, Dr. Sampson. Thank you for speaking to us tonight. I was wondering if you could comment on the disproportionate number of Black, Indigenous, and other marginalized groups who are affected by RSV, influenza, and COVID, and the disproportionate vulnerability that we need to help to protect when we're talking about protecting all children.
So thanks for that question. It's a very important one. Definitely equity and equitable access to healthcare is front of center for all of us. I don't have the current statistics to be able to tell you about what's happening right now from that demographic lens. We do know that COVID infections in Canada were disproportionately seen in communities that were in higher vulnerable or higher risk communities, and also in racialized demographics differently than compared to the population at large. But I don't have a comment for you now. We know historically in Canada that RSV hospitalizations and infections are more significant and requiring more hospitalizations in Indigenous children.
Thank you. Good night.
All right, and that brings us to Trustee Bell.
Great, thank you. Thank you, Dr. Sampson. You emphasized the temporary nature of a potential masking requirement, and you mentioned to the end of the situation. I'm wondering if you would be able to tell us what are the types of metrics or indicators that you would recommend that a board looking to move beyond strongly recommending to requiring that we would look at? And that's the first part of the question. And the second is, as a partner organization, would you be open to the Ottawa-Carleton District School Board consulting you on metrics that we could in fact make public to help the public understand when we would put in a masking requirement and when we would remove one? Thank you.
Thanks. Thanks for those questions. So, of course, CHEO is always here to partner with all organizations in the community that also have the health and well-being of children as their mandates. And so we do partner with Ottawa-Carleton District School Board and the other school boards, and would always continue to want to do that. I think that we need to look at our public health guidance about what are the important factors to look at. As in the Ontario guidance, the Ontario Scientific Advisory Table guidance for return to school for 2022-2023, it said at that time that what should be looked at is the epidemiology of viral circulation at a regional level at that time, including the impact that is having on the capacity of the health system. And I think specific metrics, we should consult with our public health colleagues to look at it at a population level to make that determination. And so at this point in time, given the level of viral infection in the community that we've heard from Ottawa Public Health and Public Health Ontario, as well as the impact that we know it's having on the health system that I shared with you this evening, that's where the recommendation came from.
Thank you very much, Dr. Sampson. That's it for me.
Trustee Blackburn.
Thank you, Madam Chair, and through you, and thank you, Dr. Sampson, for coming this evening. So my question has to do with the lack of supply of children's medications. So I'm not a doctor, but when my daughter, who's now an adult, was an infant and toddler, when she got a fever, I always had a ready supply of Tylenol or Advil or whatever the case. And I was able to manage that fever on my own without the assistance of a doctor. We have information that those medications are returning to store shelves in Ottawa. Do you anticipate that this will assist CHEO in regards to visits to emergency rooms?
Yeah, thanks for that question. Of course, we're all really distressed to know that the usual tools that parents have to support their children when they're unwell with fever have not been available due to these medication shortages. We have recently been told that there are supplies that are coming into the country, and we're hopeful for that. I do also just want to point out that on CHEO's external website, as well as links through Ottawa Public Health and many other organizations, there's very good information sheets to try and help support parents through this time, how to care for their children. And, you know, I do think that also on the website, there's good information to help parents make the choice for their child. Do they need to come to the emergency department or not? And I hope that that's of help, and happy to ensure that those resources are shared with the school board so they can be distributed to families.
Thank you for that. So just to clarify, my question was, do you anticipate that if children's medications are more readily available, will that alleviate the pressures at the hospital?
You know, it's not possible to answer that question. I'm sorry if I'm being a bit vague. I think every little bit helps. And if some parents are coming to the hospital only because their child who's otherwise well has a fever, then yes, we can anticipate that that would help. There are other ways to reduce fever. That was the purpose of my my answer, and I'm hoping that parents can avail themselves of that information.
Thank you. And I believe at one point in your deputation, you used the word universal masking. And obviously, if the three other boards in this city are not having this debate, they will not be mandating masks. The rest of the city apparently is not mandating masks. So if there is no universal masking and children will not be masked outside of school, will it really be of assistance if, in fact, this board mandates masks?
Yeah, really, really important question. Thank you for that. You know, the best and most effective approach to rapidly slow and stop the current viral wave would be for sure for everyone to wear masks indoors in crowded spaces, and to do all those other things that we said, like stay home when they're sick, make sure they're washing their hands, get vaccines that they're eligible for. But short of that, every little bit helps, though, and even without general masking mandates in the community, if every student and teacher and staff in a particular classroom is wearing a mask, and who can do so comfortably, and every class in that school is doing the same, then it will decrease infection and viral transmission in that cohort of students and their families. And, you know, ensure that that school transmission is reduced in that school setting, and ensure that kids can stay in school all through the year this year, which we know is so important for their health and development and learning.
Thank you for that. And through you, Madam Chair, my last question. If this situation is so dire, as you say, why are you speaking to a school board of trustees, and why is not Dr. Etches or the province mandating this, and mandating it for everyone, which actually would make it effective, and instead of just this piecemeal approach, which in my opinion is not going to be helpful and could cause more harm than good?
Sorry, I didn't hear your last statement.
If we adopt this mask mandate, it's my position that we could cause more harm than good.
Okay, so I'm just going to answer the question that you posed, which was, you're asking me why is public health not mandating masks, if I understand it correctly. So, I can't really speak for public health. I'm here to tell you as a physician and on behalf of CHIO, that too many kids are getting sick from preventable viral infections right now in our community, and that it's causing other children to lose access to the healthcare they need and deserve. I'm here to tell you that masking is one of the numerous layers of protections that we know works to reduce the number of infections. And the decision about how best to get staff and students to wear masks inside your schools, the OCDSB schools, is the decision that you're going to have to make this evening. If you have a follow-up question around harm, I'm happy to address that. I'm not sure if that was a question or not.
Sorry, Trustee Blackburn, but you are out of time. That brings us to Trustee Nash.
Thank you, Chair. Good evening, Dr. Sampson, and thank you to CHIO for everything that you do. In terms of the current situation and the children that you are seeing, can you give us an indication in terms of school-age populations? Because my understanding is you're seeing more younger kids. Can you give us a situation as to the ages that you're seeing?
Yeah, thanks. Really good question. And so I don't have all the numbers in front of me at this point. We certainly are seeing the majority of children that are being admitted in younger children and in young school-age children. We are still seeing older children being admitted as well. An important part about stopping the viral transmission in the community is also trying to protect those very, very young kids that can't get vaccines, et cetera. And often those are siblings of school-age children. So unfortunately, I'm sorry, I don't have the numbers this evening to give you the exact proportion, but it is the younger children that are the higher proportion of hospitalizations, although we still see it right across the age continuum.
Thank you. And in my next, I've read that RSV cases are high because children were shielded from common infections because of COVID restrictions. Is there evidence to support this?
There's no evidence to support that. The belief is that because of the protective public health measures that were in place, which included masking, physical distancing, people staying home for extended periods, and the significant amount of COVID circulating in the community, that was the abundant virus at that time, that there was a cohort of children that have not seen RSV before this year. And so that is one of the thoughts as to why we're seeing so many children all at once get RSV at this point in time. That doesn't mean, though, that it's hard to know cause and effect by what's happening from that perspective.
Thank you.
And that brings us to Trustee Scott.
Thank you, and thank you, Dr. Sampson, for being here. I saw your presentation to the Ottawa Board of Health earlier this month, which was a very well done presentation. Are you aware whether the Ottawa Board of Health has actually received any answer from the Minister of Health and others to whom they sent their letter?
Thanks, I am not aware of that.
Thank you for that. And I did have one other question, which I think matters to me in terms of the expectations around how children are using their masks and not using their masks, and the younger children that have older siblings who are school age, who are sick at CHIO. Is there any clear evidence that links the source of infection to their older school age siblings, or is that just a speculation?
We definitely know that young infants are getting exposed to their infections from somewhere, and we definitely know about household transmission of infections. All of these infections transmit through different modalities, and so I don't again have the data to tell you, but we do collect that to know, do you have a sibling at home that's infected when somebody gets admitted to hospital? But I don't have that that number for you now.
Thank you.
And seeing no further speak. Oh, yes, go ahead.
Hi, thank you, Madam Chair, and thank you, Dr. Sampson. And on behalf of all the students, we thank you so much for all the work that you do to keep us safe. We truly, truly appreciate it. I kind of have two questions. So the first one is a question that I heard a lot from my peers at school, and I want to convey that to you. Many asks if mask mandates are effective when in reality, they're only being practiced in classrooms. So you often see that students in classrooms, they would wear masks, but the moment they leave the classrooms, the moment they get into the hallway, they take off their masks. They are in big gatherings in very crowded areas without their masks. The moment they get, on their lunch break or on their recess break, they are not wearing their mask. And so is a mask mandate effective when it's not being practiced so strictly by students? That's my first question. And then my second question would be, you find many people asking to be exempt from wearing a mask. What would you say are appropriate reasonings for not wearing a mask or for being exempt from wearing a mask?
Okay, thanks for those questions. And if I understand, you're the student trustee at the board, so thank you very much for bringing your voice forward, which is so important. And those are two great questions. So, of course, to be most effective, it would be ideal if everybody was able to put their mask back on in all sort of indoor spaces, adults and young kids and teenagers and everyone, and keep them on. What we do know, though, is every little bit helps. And so will it still be of some effectiveness if teens and younger kids are masking in their classroom environment, which is tends to be in many of our schools in a sort of enclosed, more crowded space? Then yes, we know that will help. It's also important that all of the students also know about the other layers of protection to help keep them safe that I've talked about a lot, but staying home when they're sick, and hand hygiene, and trying to physically distance in crowded spaces, etc. So that was your first question, which was really good. And the second one is about a mask exemption policy. And I think what's really important when it comes to masking is that kids wear a well-fitted mask that they're comfortable wearing. And I think the decision about who qualifies for an exemption or not really should be an individual conversation with a child, their parent or guardian, and their healthcare provider. There's certainly many reasons why some children and youth may not be able to wear a mask and should be exempt, and there needs to be a one-on-one conversation about that. And there's also many ways to support kids in being able to comfortably wear masks as well.
Awesome, thank you so much. And if I may ask one follow-up question, if that's all right. So I have a brother with autism spectrum disorder. He's nonverbal, and so the way he communicates with his teachers is through facial expressions, and the way he makes sense of the world around him and understands his teachers is through their facial expressions and through reading their faces. And many special needs families and special education workers have said that there is a difficulty when we're wearing a mask and we're also trying to communicate with special needs students. So I guess what would be your comments on that? Would you say a mask exemption in that case would be fair?
Yeah, thanks so much for that really important and thoughtful question. And I would turn it around and I would say that's why all of us that can wear a mask comfortably to not only protect ourselves, but protect everyone else should do so that children and youth and adults like your brother at home can feel safer in being able to not have a mask on, and those caring for him can be safer so that they can participate in their learning and get all the supports and care that they need. That's really important.
Thank you so much.
Seeing no further speakers, I would like to thank you profusely, Dr. Sampson, for taking the time to come and speak with us and for wading through our multiple recesses. Thank you so much. I'm sure that everyone here has listened to what you have said and will ruminate on your comments. Thank you.
You're welcome. Thank you very much, everyone.
Okay. With the conclusion of Dr. Sampson's presentation, I would have invited Dr. Etches, but we have instead received a written submission from Dr. Etches, which has been included on our public website. That brings me to 8.0, matters for action. I'm going to look to Trustee Kaplan-Murth to introduce your notice of motion.
Thank you, Chair. I would like to move the motion as found on page 102. In the interest of time, I will not read out that motion, but people have access to it.
Would you like introduction?
Yes, I would. Thank you.
You have 5 minutes.
In the last few hours, we have heard from delegates who are parents and healthcare experts who support a temporary mask requirement, and also from delegates who are against the requirement of masks. You will also and have also heard from Vera Etches, if you read her note, and also from Dr. Lindy Sampson, an infectious disease expert and chief of staff at CHEO. In the last week, my fellow trustees and I have received a handful of letters from a loud minority of people, some of whom are truly students or parents in Ottawa, but others are not residents in Ottawa, or they're writing from outside of Ontario and even outside of Canada. They have made some erroneous and misinformed assertions. We have seen in the last 3 years that disinformation travels rapidly. It's difficult for people to differentiate between reliable and unreliable information. It was brought to my attention that there was even a Facebook group in Ottawa dedicated to blocking our mask requirement. They can mobilize in ways that others cannot. There is no equivalent movement for the weary, concerned parents who are sitting in the emergency room at CHEO or phoning their family doctors and their pediatricians, desperate because their children are struggling to breathe. The parents of infants and toddlers and preschoolers who are in the ICU right now do not have the time to speak here tonight. Who else was missing here? The parents of children who can't afford to take off time from their evening shift to delegate, let alone to take off time when their children are sick. The mask requirement is important for the multi-generational families who live in poverty and are more likely to have children who struggle with asthma or grandparents who have diabetes and chronic pulmonary disease. The mask requirement is important for Black and Indigenous families who are at high risk of ending up in hospital with respiratory diseases. To all the students and educators and their families who are begging us to help you to do something to make school safer, I hear you. I hope that my trustee colleagues are also listening. Tonight has been difficult for many reasons. Well, the last 3 years have also been difficult. We can do something simple and effective right now to help keep children and educators healthier and safer. I ask you to think about the parents who have to explain to their children what resuscitation means because they are listening to the news and they know that their peers have had to be resuscitated. Masks are most effective when everyone wears a mask. It's not sufficient to tell high-risk children to mask and leave others unmasked. One parent told me that her 4-year-old child with diabetes wears a mask at school, but he is only one of 4 out of 50 children in his class who do. They had to rush him to CHEO's ER at midnight because he had RSV and he couldn't breathe. Her terror as they had to stabilize her son's breathing is why she's begging for a mask requirement. Her son has lost over 21 days of school so far this year, and we've heard from many parents whose children have lost a lot of days of school and parents who've had to pull their children from school for their own safety. I ask you also to think about the health and safety of educators. The failure to protect the school environment through universal masking means that the school currently excludes and therefore discriminates against children and staff who are immunocompromised or who have health vulnerabilities. To attend in person, these children are being required to put their lives at risk. The current government policy of recommending but not requiring masks is not following the precautionary principle, instead jeopardizing children's safety. The individual choice allows those with an anti-mask sentiment, indifference, or ignorance to endanger others, and it promotes exclusionary ableist harms. It is discrimination itself, and it's leading to illness, disability, and death. Sometimes it's necessary to do what is difficult for the good of the population, for short-term and for long-term health reasons, to ensure that schools can remain open, to ensure every student and educator has a safe learning environment. We must do what is difficult for the most vulnerable in our community, even if we lose support from some people. We cannot address all the issues, but we can adopt a simple measure, a temporary mask requirement, to quite simply take better care of each other. It's our responsibility as the Board of Education to ensure the health and safety of our students and our educators. On behalf of every parent and student and educator, I respectfully ask you to consider this motion. I turn the table over now to my colleagues to discuss. Thank you.
Thank you, Trustee Kaplan-Murth. I'm actually going to look for a motion to move into rules of committee. I see Trustee Lee looking for a seconder. I see Trustee Scott. All right, all those in favor of moving to rules of committee? And that passes. All right, now that we are in rules of committee, I'm going to make a recommendation that we address this clause by clause to keep the debate focused. And so each of you should have gotten a piece of paper with the letters beside each. So we're going to start with clause A, and then at the end, we will have a chance to come back and discuss the motion as a whole if it has been amended.
Madam Chair, point of personal privilege.
Yeah.
The sheets of paper were removed after our last recess, so some of us do not have
Okay.
the sheets that were provided at the beginning of the night.
Okay, give me 30 seconds and we will fix that. We're going to throw the first one on the screen and then we're going to get everybody else those sheets. It's just the first clause of the motion is clause A. If you look at the screen, it's now on the screen. Okay. I have Trustee Blackburn. Would you like to speak to clause A?
Thank you, Madam Chair.
Point of privilege.
Yeah.
Can I move to make amendments to the
Not
motion
until-
before we
Not
discuss?
until you have the floor.
She would like to present it as amended. The motion.
Can I present it as amended? No.
No. No, sorry.
Okay.
You can
Fine.
amend it though.
Yep.
Trustee Blackburn. Remember, this is a brand new board, so I'm being extra nice to everyone. Trustee Blackburn.
Thank you, Madam Chair. I find this way of debating new and interesting. So I will have through you, Madam Chair, questions to the director. But before I do that, I will say I was elected for the 4th time to represent parents, students, and members of my community. Those people know that I care very deeply for all students and all staff. And from time to time, as colleagues, we will disagree what that looks like. But never would I challenge anybody's care and compassion for all students, despite the fact that we may disagree on what that looks like. So I hope that my colleagues would always reciprocate my sentiment in that regard. So with that in mind, through you, Madam Chair, I do have some questions to the director, and not sure if she'll delegate the responses, but here it goes. So part A, Madam Director, can you give me an idea of what your interpretation is Oh, okay. So the N95 masks, it's my understanding we don't have those for small children. Is that correct?
Through you, Madam Chair. Yes, that is correct.
And is it your intention to procure those for small children in the event this motion passes?
Through you, Madam Chair, I am unaware of our capacity to be able to procure N95 for small children. Perhaps the AD Reynolds is able to respond to that question.
Thank you, and through you, Madam Chair. At the moment, oh, it's not on. It's just not working. The ministry has a fairly extensive list of PPE and supplies that can be ordered. Presently, N95 respirators or KN95 respirators in children's sizes are not listed as something that we can order. I know that we've been put in touch with a community organization that may be able to donate N95s. I've yet to have a conversation with them around whether or not they have N95s appropriate for children. But we will, in the event that this motion passes, we will explore those opportunities.
And it's my understanding what's our supply left for N95 masks for adults? And I think there's some confusion amongst trustees and in fact, perhaps in the community. Is the province still funding PPE giving it to us?
Yes, from the list of supplies that they do have, we're permitted to order at no charge to the board for now, as far as we know.
And if you would like, Madam Chair, through you and to the trustee, AD Jerwa is able to respond to the question about the supply that we have. AD Jerwa.
Through you, Madam Chair. We do have about 10 days, depending on obviously the number that we need to put into the schools or to the teachers. We do have at least around 10 days of supply or around 350,000 surgical masks, much smaller supply of N95 masks right now.
Thank you, Madam Chair. Those are all my questions. And I guess for now, I would just like, I guess I'll wait till point B to speak again unless I feel the need to speak again on point A.
All right. I have Trustee Jenkins. Did you want to speak to point A?
Thank you, Chair. My question was also on procurement. How long did it take for the board to receive the supply of masks during the last request?
Through you, Madam Chair. So I can't say how long it took to receive the last orders that we actually received, but I will say that we recently placed an order for 10,000 more KN95 masks. And it's been about 10 days and we still have not received that order. So I'll put that out there as a kind of a general guideline that it's taken at least 2 weeks or more to get the actual stock from the school board.
Thank you. Thank you. And what about the costing of the masks? And do we have that in our budget for additional purchase of masks?
So these masks are being provided through the ministry free of charge to us as a school board. If we had to purchase K95 fitted masks for children, those are not currently being covered by the ministry. So we would have to look into that.
All right, thank you. I now have Trustee Kaplan-Murphy.
Am I allowed, sorry, I just
Yes,
don't know the
now you
rules.
can make
Am I allowed
amendments.
to suggest what I would add to amend here?
Yes, so now you can propose amendments.
Okay, so I would propose an amendment to this clause to say that that it should be it should read use of surgical or N95 or other well-fit masks by all educators or staff or students. That way, by saying or other well-fit, that would include children who have a preference for wearing a cloth mask. As Dr. Sampson said, anything is better than nothing. And I would also add as a comment that it really doesn't have to be an N95. It even, again, if it's surgical masks that we have in free supply, that is significantly better than no mask at all.
Okay.
So that, I don't know if I have to formally say to amend that, but that's the amendment I would add would just be to say after, I'd say of surgical or N95 or other well-fit masks.
Okay. So there is an amendment on the table. How this works is if you think the motion is better with the amendment, you support the amendment. You do not have to support the motion as a whole, but if you think the motion is better with the amendment, then you are going to support the amendment. Okay. Does everybody understand how the amendment works? If you think the motion is better with the changed text, you support the amendment. Dr. Kaplan-Murphy has introduced the amendment. Does anybody have comments? I see Trustee Scott.
Thank you, Mr. Chair. I do have some problems with the phrase well fit. I think it should be well fitting or well fitted.
Would you like to propose that as a sub-amendment?
I would be happy to do so.
Does anybody have a disagreement with the difference between well-fitted or well-fitting? No? Okay. All those in favor of the sub-amendment put forward by Trustee Scott to change it to well-fitting, raise your hand. And those opposed? I see none. Okay. That brings us back to the amendment. Does anybody else want to comment on the amendment? Seeing none. All those, I'm going to call the question. Do you need a wrap-up of the amendment?
No, I do not.
Okay. All those in favor of the amendment as proposed? And that passes. Trustee Kaplan-Murphy, you still have the floor. Are there other changes you would like to make or propose to Part A?
Yes, there was one other amendment, which was a student, or actually it might have been another trustee had been approached asking about what about use of OCDSB buildings when it's not school hours. So I would amend to say to educators, staff, and students in all OCDSB buildings during normal school hours or during normal school, during instruction, or I'm not sure exactly what the wording should be, but it would be to say that if it's being used by community for other purposes, then that would not be something that we would be overseeing.
The wording you may wish to look at is instructional day.
That would be good. So
Okay.
all educators, staff, and students in all OCDSB buildings and OCDSB-led activity during the instructional day.
Okay. Does anybody have, can we get that on the screen? Amazing. Does anybody have comments? I see, or no, Trustee Scott, Trustee Aziz. Trustee Scott.
So if we're talking during the instructional day, there are a lot of extracurricular activities that happen outside the instructional day that are nonetheless led by OCDSB staff and involve our students and happen at schools. How are those included or not included?
Director.
Through you, Madam Chair, if the motion says OCDSB led activity during the instructional day, the interpretation is going to be that at the close of the school day, that anything that happens co-curricularly or after the school day is over would not be included in this motion.
Okay. Is that the intent of the mover?
It actually is the intent because I also wrote in the exception of musical and performing arts instruction and sports and other activities. And I know that those co-curriculars are often activities that might make it more difficult. In an ideal world, it would include that, but trying to make this as much possible to be as least disruptive, but also effective during the school day.
Okay. Trustee Scott?
On this, that's all. I
Okay.
just wanted to get that clarification.
Trustee Aziz?
I was wondering if I could propose a sub-amendment to actually clarify that point, because for students who are attending extracurricular activities that are not musical, performing arts, sports, or other activities which masks cannot be worn, why not continue the masks? Like if you're in that classroom already and you're just staying for debate club, why not? Why would the mask mandate end if there isn't a reason for you to take off your mask? So would it be possible to propose a sub-amendment that says all educators, staff, and students in all OCDSB buildings and in all OCDSB-led activity, including or just all OCDSB-led activity?
Okay, so you cannot negate an amendment with a
Okay.
sub-amendment.
Okay, I just wasn't sure if there was a better wording for that, so I apologize.
I guess, can I just ask for clarification, maybe from the director, but the activities that would be included in our schools that aren't, like what kinds of co-curriculars would happen? If it's, I guess if it's something instructional, the hours of the day might extend to beyond 4 o'clock, but what other activities would be done in schools that might be prohibited in terms of wearing a mask?
Thank you, through you, Madam Chair. I think a part of the challenge is the all, because when we do start to talk about all buildings and all OCDSB-led activity, you're talking about students who are going on an excursion that leaves at 2 o'clock and ends at 4 o'clock to a museum that is off-site. And so there becomes an exception after an exception after an exception, simply because one of the things that we understand is that the instructional day typically starts at 8-ish, 8:30-ish, 9 o'clock, goes till 3 o'clock. But a lot of times the instructional day includes so many opportunities that it would be, extensive for me to try to list. Additionally, we have EDPs that are a part of our responsibility. And the question then that it begs is, what does that mean around extended day programs for children who are younger children, and who is doing the implementation there? So there is a lot of challenge around how to encapsulate all in both aspects of this, and I'm not sure what the wording actually would look like. I'm getting text from our superintendent of program and learning, who's talking about tutoring programs that are also underway that happen in classrooms and after class as well. So that's the best answer that I'm able to provide, but only to say that it is very complex and it is very difficult. But when you go into an all statement, you start to get very narrow and it starts to become very complex for implementation.
All right. Trustee Aziz, did you have any other further questions? Or did you want to finalize the wording of a sub-amendment?
Well, I didn't want to negate the
Okay.
sub-amendment, so.
All right. So I see Trustee Jenkins.
Thank you. It's just a little bit confusing in the sense that we have outside community events that happen at our schools, brownies, guides, scouts, and they're not necessarily OCDSB-led activities, they're community activities. What about, I mean, there's just, we could name hundreds of things that, so it's a bit confusing, this part.
Okay.
Madam Chair, can I respond to that?
Sure.
That's a great point, Trustee Jenkins, and that's exactly why I wanted to emphasize in all OCDSB buildings and in all OCDSB-led activity, so that other programming that is happening on weekends that is not OCDSB-led, we're not responsible for enforcing masks if there's a basketball game held by a different association that is not OCDSB jurisdiction.
So what I'm hearing is that some people want to strike the part about in our buildings and only have it be activities that we lead, whether they are extracurriculars or before school or during the day? Is that the feel that I'm getting from the room? I'm seeing some nodding. I'm seeing some hands that doesn't look like nodding.
My concern is not the buildings or OCDSB led activity, it's during the instructional day.
Okay.
Because there are activities that are OCDSB led, but they're not during that 9 to whenever or 8:15 to wherever. Like they're before or after, sorry.
Okay. So right now, the motion on the floor is to add the words during the instructional day. Do people have changes to that, or would you like to vote on the language as it is? I see Trustee Kaplan-Murth and I see Trustee Blackburn. Trustee Kaplan-Murth.
So perhaps a good compromise would be to amend the statement to say all educators, staff, and students in all OCDSB-led activity, scratching the buildings part of the phrase, with the exception of musical, performing arts, instruction, or sports in which masks cannot be worn. And not put in during the instructional day part. Can we change that or no? So I would withdraw my amendment to the during the instructional day part, and instead I would amend it to take out the in all buildings.
Does anybody oppose the withdrawal of the amendment? I see Trustee Scott. Okay, so we're going to have to vote on it. So right now, the motion during the instructional day is on the floor. If you think the wording is better with this, I see Trustee Blackburn. Yeah.
I have a question of clarification for staff.
Mhm.
The definition of instructional day, through your chair to the director, does that include EDP?
I think that is up for debate because EDP by its extension of the school day.
Correct.
But it is not instructional time.
Right.
So it is very gray. And we don't know what it would mean in terms of implementation. So it's not a part of the instructional day. It is an extended day and it is a different program.
So what I hear you saying is that children would not be required to wear masks from 7 in the morning till 6 at night, just during instructional time.
That's what I would interpret this to mean.
Thank you, Madam Director.
Okay. With that understanding, does anybody have further comments or should we vote on this amendment? No, seeing no further comments. If you like the language with during the instructional day, raise your hand. All those in favor? I see 1, 2, 3, 4, 5. All those opposed, raise your hand. 1, 2, 3, 4, 5. All those abstaining, raise your hand. 1. Okay. That motion fails to be added to the text on the basis of a tie. 5-5 with 1 abstention. Nilly, you still have the floor. My apologies. Trustee Kaplan-Murth, you still have the floor.
Thank you. So I would propose the amendment that this reads that staff be directed to require from an occupational health and safety perspective use of surgical or N95 or other well-fitting masks by all educators, staff, and students in all OCDSB-led activity, with the exception of musical, performing arts, and so on and so forth. So just taking out the OCDSB building, which should also help with the EDP issue, because the extended day program is not an ODSB-led activity per se. Is it? Okay, it is.
Okay.
Oops. Okay. All right.
So go ahead, Director.
So for clarity, if you remove during the instructional day, what that means is that children will be expected to wear masks during EDP because that would be OCDSB led. You would also be expecting students who are coming to a high school dance after school that might start at 7 o'clock to wear a mask. It means that any school activities that may not be sports, but someone raised the debate club, for example, would be wearing masks. And so that means that you would have a high school in a debate experience with the secondary school from the Catholic board. Our students would be masked, those students would not be masked. So just so you understand what that means when you say all students outside of the instructional day as well.
Okay, understood. I think actually that those are environments in which we should be masking. So I would leave it as written.
Okay. So there is an amendment on the floor to strike the words OCDSB buildings in all. I see a question from Trustee Jennings.
My question is on busing. When students get on the bus in the morning and then at the end of the day, is that considered an OCDSB led? Yes. So that changes the timing. Is that just incorporated then in?
No, because this is, you've taken out, through your chair, you've taken out the instructional day. So the transportation is an extension of the school experience. So this motion would include the bus drivers implementing a mask mandate.
Okay. Anything else, Trustee Jennings?
Well, actually, just a concern, will the bus drivers be enforcing? Yes. Is it in their jurisdiction to enforce mask mandates?
Through you, Chair, that would depend on the interpretation of enforce. The students could arrive on the bus. The bus driver might say, you're expected to wear a mask. If the student is not wearing a mask, the bus driver is unlikely to not collect those children and take them to school. What they might do is file a report with the principal, and it then becomes the principal's purview to respond to that piece. And the capacity of a bus driver to be able to enforce and implement, I would imagine would be somewhat limited. I would suggest that would also be faced with some conflict.
Trustee Lee.
Thank you, Madam Chair, and through you for the director. Just a point of clarification, is Austin not, or sorry, the OSTA technically a separate arm's length entity and therefore not an OCDSB led activity, even though we have OCDSB representation on it?
Thank you, through you, Chair. So OSTA is in fact an arm's length, but the bus and the bus transportation and the experience of buses are considered to be an extension of school. And so the kinds of code of conduct, for example, the expectations around rules of engagement, if there are discipline issues, those pieces are in fact the purview and the responsibility of the OCDSB and the OCSB. And so students, while it is that the operation of transportation is done by an external company or external companies and governed by an external body, the students who are a part of it and parents and families are all overseen through the district.
And thank you, Madam Director, and again, through you, Madam Chair. With that being said, though, as a motion being put forth here by the OCDSB board, how does that get implemented through OSTA? Because again, anything that happens on school bus is still overseen by OSTA, and without them also moving a similar motion, how does that? How can we enforce anything through OSTA as an arm's length entity?
There would be some difficulty and challenge with trying to achieve that. We can ask for that as, again, it's the expectation because it's an extension of the OCDSB, but our capacity to secure accountability and compliance is limited.
Okay, thank you very much.
Trustee Scott.
Thank you. Has the Ottawa Student Transportation Authority been consulted on this?
Through you, Madam Chair, not to my knowledge.
I guess my concern there is that with the existing shortage of bus drivers and the difficulty recruiting bus drivers and the absolute need for bus drivers, particularly in those areas of the district where we have no alternatives to yellow buses for transportation. I'm not sure that this would help very much with recruiting drivers for the buses. And I think it could exacerbate the transportation problems because frankly, children don't learn if they don't get to school.
Trustee Aziz?
I agree with what Trustee Scott just said, and I'm wondering if the discussion of enforcement should be paused until we get to point D, which discusses enforcement and consequences, because I think it's agreed that OSTA cooperation or lack thereof and enforcement needs to be discussed in detail, and that I think will be addressed later on. Am I correct?
It will.
Okay.
I have Trustee Blackburn.
Thank you, Madam Chair. I can tell you, as the outgoing president of OSTA, who is serving her second term as president of OSTA and who served a term as the vice chair of OSTA, I can tell you, if we don't amend this to make it clear that bus drivers will not be required to enforce this, we will lose more drivers. That is a guarantee.
Would you like to propose a sub-amendment?
I would. And since my colleague to my two right is much better than I at sub-amending, perhaps Trustee Scott, could you help me with the wording?
Would you accept with the exception of buses, comma, musical, performing arts, instruction, or sports?
Sure, if that works. Does that work?
Sorry, point of order. I don't think that they were recommending that we say that you don't require masks on buses. They were saying that the bus drivers don't have to enforce it. And so I thought we were going to talk about enforcement later.
I mean,
no.
My understanding is that one of the trustees does not want masks to be required on buses.
So I do still have the floor, Madam Chair. So I would implore my colleagues to hear what I just said. Because like Trustee Scott said, now we have to keep in mind that Trustee Scott represents an area where there are no city transit buses. The only way the students she represents can get to school, many of them, is with a yellow bus. And that's the case for many other students that we represent. Many of those students don't have, and we talk about equity and we talk about vulnerable kids. Not all parents have cars. Not all parents can get up in the morning and drive their kids to school. Many parents are working 2 and 3 jobs and they rely on that bus service to get their kids to school. So if you truly care about equity, you need, in my opinion, to protect transportation, because that's how our kids, our vulnerable kids, get to school. And it's imperative that they get to school. And it's imperative that we have people driving those buses to get them to school. And I'm telling you, those people do not need any more pressure on them about policing, masking, period. So please, my colleagues, please, I beg of you to amend this to exclude the buses.
Trustee Dixon?
They won't be able to get on the bus, right? Because the police, we know.
Also, I agree with Donna, because we all know kids in the morning when they rush, they're going to forget their masks. And if we're going to leave it up to the bus driver, we're going to be having buses with half the kids or no kids on them coming to school every day. And that's a big responsibility to leave on a bus driver.
Would you like to propose an amendment?
Do I?
Yeah. A sub-amendment.
Madam Chair, don't we have an amendment on the floor?
A sub-amendment. I see Trustee Kaplan-Murphy.
So I wanted to just comment on the shortage of bus drivers and point out that every bus driver who gets sick because children aren't masking on buses means we have fewer bus drivers. We have to think about protecting the bus drivers as well as protecting the children. Wearing a mask is not a hardship for the bus driver, nor is it for the children. And we were going to talk about enforcement later, but to say that there shouldn't be masks on buses doesn't make any sense. That puts our bus drivers at risk of getting sick. And I think we have a duty to also ensure their safety.
Trustee Jennings.
Thank you. And the other challenge is our field trips. How do we mandate masks on our field trips? But I also just wanted to acknowledge as well, in my zone, there's a large portion of my zone that is rural and absolutely 100% relies on the yellow bus.
Okay, I've heard a number of people talking about buses, but there's still no amendment on the floor. Trustee Aziz.
Sorry, I don't disagree with the concern about enforcement on buses. I'm suggesting that we pause and propose an amendment to enforcement on buses later, because that is something that will be discussed during the enforcement discussion. And
so
then we would discuss an amendment about the exception of bus drivers will not be responsible for enforcing it. Like they don't have to go around and kicking people off the bus or telling kids they can't get on the bus because of the masks. But if we ask kids to wear a mask on the bus, but not, you know what I mean? Like, I'm not saying that we should, again, this is when I want to discuss enforcement on point D, because here we're just talking about where masks can be worn, but point D is about who can enforce this. And I'm agreeing that we shouldn't be making bus drivers responsible because we will lose bus drivers.
I see Trustee Scott.
I agree with you, Trustee Aziz.
Trustee Scott.
Oh, sorry.
Mr. Chair, I think we've lost sight of where we are in terms of amendments. You keep asking why there isn't another amendment on the floor around this, but I thought we already were dealing with an amendment which was presumably to delete the words OCDSB buildings and in all.
We are.
This would not be a suitable sub-amendment to that. So before we, but the question around the buses has arisen. It is worthy of debate because it is very important. And I have to confess, I do see a little bit red when I hear people saying, well, if drivers were not exposed, they wouldn't be getting sick and you'd have drivers. The trouble is we don't have enough drivers to start with. So we have to attract enough drivers to start with, as well as an additional number to fill in behind when we have drivers who are sick, and drivers get sick every year. So I think the first thing to do is to deal with the amendment that is in front of us, and then we will have to tackle the busing issue. And I really have some difficulty trying to deal with this clause by clause because the structure is such that if you can't come to a sensible decision about whether there would be masking expected on buses or not without considering the role of the driver and others in terms of enforcement of that expectation. So are we going to deal with the amendment that is currently on the floor?
Point of order, didn't we already deal with that?
No.
I thought we voted.
No.
Okay.
We voted not to have the other one. Still you. Okay. Trustee Blackburn.
Thank you, Madam Chair, and through you. I apologize, Madam Chair. I thought when I had asked my colleague over to the right to suggest wording about busing, then you jumped in and did, and I was happy with your wording. And so I thought that's what we were going to debate. So I would like to move an amendment specific to busing. And so if we could get that up, that would be great. And then I would like to do an introduction if I may.
Okay. So if you want to sub-amend what's on the floor, you can. I consider the two to be linked. And so I consider it to be a valid in a legal sub-amendment.
Madam Chair, my very learned colleague reminds me that we need to deal with this sub-amendment, and I'm happy to do that. And then I would like a very specific amendment about busing in Part A so that it's very clear to the community where the board stands. Because it's crucial that we are clear about this.
Okay. I see Trustee Bell.
Can I call the question?
You can.
I'd like to call the question.
So what that means is that if everybody votes in favor, we immediately jump straight to a vote on what's on the floor. You need 2/3 for calling the question. All those in favor of calling the question for this item, raise your hands.
Just to clarify, Chair, I'm calling the question on the amendment.
On the amendment on the floor.
On a point of order, I believe the correct wording is a motion to close debate. In current King, there is no such thing as call the question.
Sure.
Fabulous.
We have a motion to close debate on the floor. So all those in favor of closing debate on this item, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That passes. Trustee Kaplan-Murth, you get closing, but I'm going to ask you to keep it to a minute.
Closing on this
On this
item
amendment.
of scratching OCDSB buildings and in all.
Yes.
Okay, I think that this is pretty self-explanatory and we're tired, so I don't need a minute.
Okay. Great. All those in favor of this amendment on the floor, raise your hand. 1, 2, 3, 4, 5, all those 6. All those opposed. 1, 2, 3, 4, 5, 6. That motion fails on a tie. Trustee Blackburn, you wanted an amendment.
Yes, so I want an amendment to make it clear that there will be no mandatory masking on buses. So I guess like you suggested, Madam Chair, with the exception of buses, comma, musical performing, arts, instruction, etc.
Okay.
I believe that was it.
Can we get it on the screen?
Point of order, Madam Chair.
Yes, I do have you on.
Yes, I'm sorry. I do with the wording that with this change in wording now, and I'm not 100% sure how to do this, but I am going to have to declare an interest, I believe it is, due to my day job. So if this is being voted on, then I need to step back from the table.
Your interest is noted. Thank you.
Okay, thanks.
Submit that in writing to the board office.
So I apologize again, Madam Chair. I think what I meant to say was with the exception of OSTA buses.
Okay. With the exception of OSTA buses. Got it. Is there any debate on this item?
So may I have introduction?
You may.
So I'm very always remiss to repeat myself, but I'm going to do it because this is so important. I know this file inside and out. I repeat, I have currently serving my second term as president of OSTA. I served a term as vice president of OSTA. Prior to that, I was just a board member of OSTA. If we don't include this, we are going to lose more drivers. If we don't include this, we will have even more trouble recruiting more drivers. The drivers are all adults. They can ascertain for themselves whether they or not they want to wear masks. Being a bus driver in today's world is extremely difficult. It's extremely difficult. And so adding another layer to their responsibilities, and I don't, it doesn't matter what we say about enforcement, et cetera, et cetera, et cetera. There will be chaos on the buses if we don't pass this amendment, and we are clear that masks are not required on the buses. If students choose to wear masks on the buses, fair enough, but we need to be clear about this. it's imperative that we're clear about this. We need to keep up the service that we have, and we're trying to improve that service. But if we don't include this, that's going to become much more difficult, and I fear that we will lose more service, and we will not be able to get the kids to school that we claim that we care so much about. Thank you.
Okay. Director, you wanted to comment?
Yes, through you, Madam Chair. I wanted to bring a comment here at this point because I think that the notion that this can be discussed outside of the consideration of implementability is an exercise that will get you nowhere. So you can have a 45-minute debate on the nature of this and get to the fact that it cannot be implemented, which will yield the entire discussion futile. I need to say, as the CEO of the organization, as the lead on operations, operationally, this cannot be achieved. You have indicated require, you have indicated all, and you have indicated all, and then started to make exceptions. The exceptions in a school district for the operations of schooling is infinite. What has not been discussed here, just to use the example of OSTA buses, there are black and yellow buses, there are vans, there are taxis, there are kids with Presto passes that OSTA provides. The permutations and combinations are endless. So the notion of the capacity to implement this is virtually impossible. And if you use the word require, you are then saying that you are expecting something to be done that is virtually impossible to do when we consider the nature of the exceptions that are included. I'm indicating exceptions to the operational structures. We haven't started to talk about the exceptions to the students that we are also serving, who come from a variety of capacities and circumstances. So having a debate about a motion that has all, everywhere, all the time and required is going to yield you a very futile exercise from my perspective. And I needed to interject at this point to tell you that, because the operations of school is incredibly complex.
Thank you, Director. Trustee Kaplan-Murphy.
Thank you. I wanted to make 2 points. One is that it doesn't make any sense to say that we don't mask on buses. That puts bus drivers at risk and the children on the buses at risk. And those are disproportionately the children whose parents can't just drive them to school. Therefore, we would not include an exception for buses. The exception for musical, performing arts and instruction in sports is intended to allow some of those activities that have not been able to happen over the last 2.5 years to proceed with happening. It is possible to mandate masks. We did it before. I'm proposing that we mandate masks in a way that, as much as possible, enables students to do all the things, but also most of the instructional day would end up being masked. And that is, as Dr. Sampson said, better than not masking. And it's much better than the current situation. I propose, if people are in agreement, that we deal with C and D, because those are both points, as our Director of Education has pointed out, that are relevant to all of this other discussion. It's hard to just talk about A when we haven't talked about C and D. And I had amendments to propose for C as well as for D that I think are really important.
How does the meeting feel about not just addressing A?
Madam Chair, point of personal privilege.
Yeah.
I continue not to have this sheet that everyone's referring to, so I have no idea what C and D mean.
My apologies.
Chair, given the time that we're at right now, and given that this first component deals with the crux of the matter, I would prefer to vote on this and move to the next ones as soon as possible. That's my request. Thank you.
I have heard people have strong feelings about the other ones. I'm going to open it up to just let us debate everything.
Madam Chair, if I may,
Yeah.
can I propose that we discuss the entirety of this as a whole? Because a lot of these exceptions, it don't make sense to discuss.
Yeah, that's what we're going to do.
Okay, is that what we're going to do? Okay, okay.
Point of order, Madam Chair.
Yeah.
So then do we not have to vote down my amendment or vote
Would-
on the amendment?
Would you like to withdraw your amendment?
No.
Okay. Then yes, we're going to have to vote on your amendment.
All right.
All those, does anyone have any other comments on this amendment?
Madam Chair, may I ask?
Yeah.
Would it, in correlation to what was just proposed or the amendment that we're about to vote on and what the director has suggested, would it make sense to debate or move exceptions? So with the exception of musical performing arts, but like that whole second half into its own section so that it doesn't feel, it's not contradicting the first half of the, or do you know what I'm saying? Like the first half of the motion is requiring everyone all the time, etc. But then the second half is listing exceptions. And then we have exceptions later on. So would we not, can I propose that we move to put all the exceptions in one paragraph so that exceptions of students with disabilities or other reason, exception of OSTA buses, etc., are all in one spot?
We
Is
have
that-
to deal with the motion on the floor at this time.
Okay. Okay.
So yes, Trustee Scott.
So currently we do have an amendment on the floor.
Yeah.
And following that, I heard someone suggest that we should vote just on Part A. And I've heard also that people say we can't really do that unless we really can consider the whole motion because it's all intertwined. So what is the proposal then, once we deal with the amendment that's currently on the floor?
Once we deal with the amendment, we're going to open up the discussion to all of the parts of the motion, as opposed to just Part A, which we've been doing. We're not going to vote on Part A by itself. We're going to just open up the floor to amendments to all the motion.
Thank you for the clarification.
I see no other speakers. Therefore, I'm going to go back to Trustee Blackburn for a brief wrap up.
Please support this amendment.
Okay. All those in favor of the amendment as proposed? I see 1, 2, 3, 4, 5, 6, 7. And opposed? I see 1, 2, 3. And noted abstentions? Okay. Yes. And that motion passes. With that, we're going to open it up to discussions to Part B, C, D, and E. And I'm going to take them in the order I saw them, which is Trustee Jennings, Trustee Kaplan-Murphy, Trustee Bell, Student Trustee, Trustee Scott. Okay, that's the order we're going to go with. Trustee Jennings.
Thank you, Chair. So I'd like to get clarification on Section C, that children or adults with written medical exemptions from their physicians on the basis of documented disability. What about our students that have an IEP? Are those students, do they specifically have they been diagnosed by their family physicians?
Director.
Through you, Madam Chair, not necessarily.
So we have many students that have an IEP that they should also be exempt from wearing a mask if it interferes with their education. That's my comment. And Section C, enforcement. We've certainly seen this evening how passionate our community, the city is. And so I really have struggled with the safety of our educators the safety of our students who choose not to wear a mask. You know, part of our duty, our role as trustees is to promote student achievement and well-being, to promote a positive school climate that is inclusive and accepting of all pupils, and to promote the prevention of bullying. So I have serious concerns about those students who choose not to. We have parents that have said that they are giving the okay for their children to not wear a mask. How are we going to enforce mask wearing? The example was used that we would enforce them similar to students who are caught smoking on school property. We have legislation that refers to children who are caught smoking, but we don't have legislation or punishment for non-wearing of masks. How do we enforce that? We have 70,000 students in our district, 160 schools. On average, let's say we have 20 kids per day that choose not to wear a mask. Are we lining them up at the principal's office every day? Are we going to be overrun with suspension appeals? I just have serious concerns how enforcement, and we certainly saw this tonight, the passion that came from our community. And then section E, temporary. It's really an elusive figure, a time period. And, you know, the expectation parents are sending in, are we going to be masking, you know, till eternity? So I just have serious concerns about enforcement. I have serious concerns about, you know, written medical exemptions. I think it's unfair to our special needs community. And I guess that's it for now. Thank you.
Okay, Director.
So to respond to the trustees' inquiries pertaining to the medical exemptions, it is important that there is noted that there is a cost to having documented documentation from a physician. So where it says written medical exemption from a physician, there's a cost to achieving that. If I could ask Superintendent Hall to speak to that item, please.
Thank you. Through you, Chair. So what we do know is for employees to get their abilities form completed, which is our standard medical form, which is issued through our wellness division, our employees need to take those forms to a physician and get them completed based on the needs that they have. We know that physicians do charge. It's common practice. What we hear is about $40 to $50 for that medical documentation to be completed. And those employees with physicians are able to sometimes access those physicians. Sometimes there's a wait where other staff members do not have a family doctor or access. So they would have to access clinics to be able to do that. So we have many employees, close to 14,000, I think 12 to 14,000 employees in various employee groups. So they do need to complete that and return it to us through our wellness division. And then from there, our wellness coordinators put in place a plan for those employees who have provided that medical documentation.
Thank you, Superintendent Hall. So that is to say that not only is there a cost to employees, but for students, children to achieve a medical exemption, it also requires an appointment with a doctor, access to a doctor, and it is a cost item. So it is not free. And so that does beg a question about accessibility of this opportunity for an exemption. Those who can afford it can get one, those who can't. The other piece in terms of the enforcement and violations, the trustee raised the question of the example that we saw here about safe and healthy workplaces for employees. The enforcement to enforce required per section A the motion would then put principals, school leaders, educators in the face of the experience that we have had this evening in all of our 147 environments. The exception being that from kindergarten to grade 3, we are not permitted by law to suspend students. So if there is a question of what required and enforcement looks like, essentially what we will be in the face of is what does that look like in terms of educators being able to lead that charge and continue to work in a safe working environment.
Right. Trustee Kaplan Murph.
Thank you. And I thank you for your comments, each of you. I actually had already written out some amendments, but because of the process, they had to wait. So I'm going to just put them all forward now as we're going to go through all the things. In terms of medical exemptions,
Can you do them one at a time?
Yes. So number one, in terms of the paragraph that starts with children or adults with written medical exemptions, I would cross out written medical exemptions from their physicians on the basis of documented. So cross that out. So instead I would read children or adults with disabilities and then add, or to whom wearing a mask would pose a hardship or interfere with their ability to function as students or in their educational or staff roles will not be subject to this mandate. So I am specifically saying that it's broad. People can self-identify as having a disability. It does not require a physician. That disability would, yes, Trustee Jenikins, that would include IEPs. It would also include children with neurodiversity or other students and staff. And it would also include speech pathologists, and it would also include custodians and anybody else who felt that it would in some way pose a hardship or interfere with their ability to function. So
Okay.
that's my proposal.
We're going to put the language on the screen. While we do that, I'm going to call the 10:30 vote. If you are in favor of continuing this meeting after 10:30, please, is everybody listening? So how this works is if people are in favor of continuing this meeting after 10:30, you support the motion to continue. If we fail the motion, then we end in 3 minutes. Does everybody understand? It drops. It'll come back to the next meeting, or we'll have to call another meeting to deal with it.
Madam Chair,
Yeah.
over here. Hello.
Yes.
Is it possible to have a break?
No.
No. Okay, thank you.
Sorry. So all those in favor of continuing past 10:30, raise your hand. 1, 2, 3, 4, 5, 6. We are not continuing past 10:30. So we have 2 minutes. Okay. So with that, I'm going to suggest somebody puts a motion on the floor. I'm looking for a motion to move this meeting to recess until such a time and place as the Agenda Planning Committee can reconvene. You want to vote on the motion without any amendments? I don't think it would be wise to do that, no. I see Trustee Scott.
Madam Chair, I would like to move to continue this meeting at the earliest reasonable opportunity, subject to quorum and consultation with staff.
All right, that motion is on the floor. All those in favor of the motion that Trustee Scott has presented to pause this meeting until your phrasing is a reasonable time that staff and trustees are able to make it? Okay, all those in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is unanimous. This meeting is adjourned.